Hello and welcome back to Psyche Truth. This is a massage video of the abdominal area. We're going to work on any issues of the hips, balancing out the hips, and maybe even a psoas release. So let's go ahead and get started. So I'm going to go ahead and place 2 hands on her abdomen to kind of get in tune with her nervous system, because the abdominals can be more tricky. They can be sensitive, can feel a little weird for your first time. So I'm strategically placing my hand on both sides of the rib cage to feel any discrepancies between the left and right, and on her lower belly to see how much she can breathe or lift the weight of my hand. And as she's doing that, I feel a tug and a pull, but I'm just going to follow the rhythm of her breath. As you can see, it's gentle. And there's not a lot of pressure involved. This is just to get her used to it and get this brain open without tickling her or stepping over any boundaries. And sometimes it's nice even to just compress from the sides to remind the brain that you have sides and send the message that we're about to work this area. So I'm going to sweep across and do a little bit lighter and longer strokes. When you're working things like the abdomen, it's important to be aware of like the floating ribs on the side of the rib cage. They're floating because one side is connected to the rest of the rib cage and one side is not, and it kind of sticks out there. So we don't want to run into that. It can be uncomfortable when you get caught up in those floating ribs. But I do want to see where her psoas is going and how it's functioning. I'm just going to jostle a little bit. To get the brain and Michelle in on how this area kind of spans out right to the front here and out into that TFL. We're really going for this right hip. We do have previous issues in this area. So we'll just follow the calling. It's important when you want to come into the front of the hip and maybe get into this pelvic bone. Clip your fingers on the edge of that pelvic bone and then start to press down as if you're just gliding on the inner curve of the bone. The muscle really lines that whole area. It can be intense. If they feel a lot of pressure, but you know you need to keep it, go ahead. You can advise them to breathe into the belly. You can advise them to wiggle the toes. These areas are going to reprogram the nervous system, give them a chance to breathe through it. And now I have deeper access to these psoas. I'm going to go underneath here, provide a little bit of pressure from the back of the spine up, just on the other side. It's a little tight. And then while I'm doing that, come in and palpate how that psoas is doing anteriorly from the front. Michelle mentioned a hypercurve in her lower back that she's been dealing with for quite a while. This can be from a shortened psoas. So at this moment, I'm following her body and just kind of stripping lightly that psoas, showing to her where it's tight, where it's caught, and where it's overworking. Come to the other side, see what we're working with. I'm not putting a lot of pressure or grip into my hand. I'm just sort of lightly putting some weight and then pulling, seeing which area gives and which area snags or is stuck. And I'm going to take a little bit of light pressure around the belly. And then in the opposite direction. It's not necessarily comfortable to have fingers digging into the abdomen. So I'm trying to use the softer, more broad edge of my fingers to keep it less sharp. In the human body, it's interesting that we like to cross the synapses so much. But right now, I'm feeling like it's helpful to work the right rib cage and the left hip to kind of show her how she's stabilizing around her midline. Because of the right challenges or injuries in this hip, I think the left is a huge powerhouse and stabilizer. So I'm just going to show her how much it's stabilizing by moving it around. And for a patron shout out today, we would love to call on Booyah, Moose, and Heaviside. I am feeling a lot of tension and muscle development at the top of this left hip. So we are just going to focus on it, see where it wants to take us. And once again, I'm going to go ahead and take the tips of my fingers and curl in and try and strip the inside of that curve of the pelvic bone. Much more dense on this side. It is in fact her stronger side. All right. Still feeling a little bit of snag in the rib cage. So I'm going to place both hands on either side and feel her breathing for just a minute. As she inhales, what areas is she able to access? Does one rib cage side move more than the other? Are there any tilts from left to right or discrepancies? And so right now I'm going to press up from under the right rib cage. It does seem to be tight. The back and the rhomboids, which might be from that cross we felt from the right rib cage to the left hip. We're trying to encourage more of a twist. Can you see it? Okay, good. Now that we've got that twist, I'm going to work the fascia of the lower belly just a little bit more. Because we can see this right psoas is just wanting to lengthen. And so I'm actually going to move up. I'm going to bring my hand and my thumb to kind of line this hip. And instead of pushing the bone, I want you to think that you're kind of grabbing a muscular structure in her hip and just gently encouraging it to lengthen, pushing it towards her foot. Give it a little bit of traction. And now that I've got her right hip where I want it, I'm going to attend to the left side of the rib cage. Using the diagonals and massage on the body is a trick of the trade. And it can really create good results. Here I'm just shortening their connection. As if I'm asking them to remember that they're connected to each other. I do find sometimes when someone's working my obliques or my psoas or in these tighter areas, intricate areas in the stomach, it makes my neck release, which I can actually feel happening right now. And now we're gonna grab from the other side. And work this left rib cage again. Gently, ribs can be sensitive, especially when they're changing trajectory. Watching out for those floating ribs. I can feel that her ribcage is aligned a little bit more. I can see that this right side has lengthened. And since I've been pulling, I'm going to go ahead and go in the opposite direction. Kind of roll that fascia over to the other side. Your abdominals and your stomach hold so much of your vitality. Your ability to digest food, handle emotions, process hormones and emotions in the liver. We usually freeze up in our gut when we are stressed. So I encourage everyone, rub your bellies. Breathe into them. They are your life force. All right. And this concludes our massage today. Thanks so much for tuning in today. I hope you enjoyed our abdominal massage and you feel totally encouraged to go and rub your own belly. I will catch you guys on the next video. And if you did enjoy today, please tune into our Patreon. Have a good week.